Hi everyone, nice to meet you. My name is Zain. I am a research analyst at Sunway Center for Planetary Health, Sunway University, based in Malaysia. Today I will be your moderator for one of the very important topics on health core benefits of climate action. So I know probably most of you know this already, but there are three main course objectives, which are we like to increase health professional knowledge, self-efficacy, and communication skills related to the climate change in health. We like to expand global workforce capacity to develop and implement educational programs on climate change in health. We also would like to build and strengthen an agile and informed community around climate and health education, advocacy, and policy. So this is where we are at today. We are the penultimate session of this course before we have the final session 10, and we have the very big examination. So for the specific learning objective today's session, we would like to explain the healthcare sector's contribution to the climate crisis and its role in climate change. We also would like to identify and describe the health core benefits associated with climate change mitigation strategies, including improved air quality and reduced incidence of respiratory and cardiovascular diseases. We would like to explain and understand the importance of interministerial collaboration for integrated health consideration into climate mitigation plans, including strategies for promoting core benefits and monitoring health outcomes. Today, we have about a 90-minute session, 35 minutes of expert lectures, and followed by 2 case study presentations, 15 minutes each. And the session will culminate with a question and answer section. Please remember to put your question on the Q&A on Zoom. And if you are doing 2 things at the same time, remember that the session will have a video recordings and all the resources will be made available on the course website. The attendance is automatically recorded during the live Zoom session and only counted if you join using your personal Zoom links that you got when you first registered. But unfortunately, it's not counted if you join with a colleague link or using YouTube views. To get a certificate of participation, you have to attend 7 out of 10 live session and pass the final exam with a score of more than 70% at the end of the course. The exam must be completed using the same email address used to attend the Zoom sessions. And the exam link will be sent on the final day of class via email and WhatsApp, and we close on Sunday. So you have a pretty big amount of time. And the format is about mix of 25 multiple choice question and true or false question. And participants should be prepared to take the exam in one sitting. So we already reached our exciting moment here. Today, we are very honored to be joined by distinguished speakers who will share their knowledge with us. While our speakers have impressive backgrounds, I'll keep the introduction brief. Our first lecture will be presented by Mr. Tom Andrew. He is the head of Health System Carbon Analytics at Centre for Sustainable Medicine, National University of Singapore. His expertise spans health system emission modelling, monitoring and reporting, cost-benefit analysis of mitigation action, and translating carbon data into recommendations for sustainable healthcare policy. Tom previously ran the Net Zero Modelling Research and Evaluation Team for National Health Service, NHS England, where he led the development of National NHS Carbon Footprint Model that provided this aggregated result at hospital level. Over to you, Tom.
Thank you so much, and thank you everyone for the opportunity to speak today. It's really great actually to see such a huge turnout from a number of different countries that I've just seen coming through on the chat. Really exciting opportunity for me to speak to you all. Thank you for the introduction. As I said, my name's Tom. My background and kind of reason for speaking to you today is I'm a carbon analyst at heart. So my background is in engineering. I worked in the UK government for a number of years looking at decarbonisation pathways across the entire economy. And then since then have kind of specialised and moved into the healthcare sector, and in particular working at the NUS Centre for Sustainable Medicine. All of that is to say that I'm not a health expert. I'm not a doctor at heart, and there are people on this call who are far better qualified than I am to tell you about the physical health impacts of climate change and of climate mitigation and exactly what that means to patients and population health. But what I can talk about is the actual transition of what does the change in the global energy system, food system, economic system look like from today to the point when we reach net zero, and what are some of the choices that exist within that transition. And given that context, what are the things that we as a healthcare community, as an academic community, as a community of healthcare professionals do to maximize and fairly spread the health benefits of that transition? So today I'll talk to you a little bit about what that transition looks like, how we go from the world as it is today to the world as it needs to be to avoid the worst impacts of climate change. I'll talk to you about some of the very direct co-impacts of doing climate mitigation, and then a little bit about some of the broader risks and benefits of the actual transition itself, some of the secondary health effects that we might see in that transition. And then I'll wrap up with some thoughts on how we as a health sector can contribute. Really grateful to be joined by two kind of really excellent panelists as well, who have some case studies, who can shine some light on what this actually looks like in practice and in the real world for the medical sector as well. So I thought I'd start with a slide. You may have seen some version of this, possibly 9 times all the way through this course, and I don't want to spend too long on the specifics of this slide. But what we're talking about today are the health impacts and the health benefits of the things that are not caused by climate change. So the impacts of the transition from a high carbon world today to a zero carbon world in the future. Now that's important to contextualize and recognize, because I think by far the biggest argument for mitigation is that it has an almost incalculable impact on human health, and the impacts of a world of 4 degrees plus of global warming on human health, on populations, would be absolutely devastating. That's well evidenced. It's well documented. It's something that I think hopefully everyone on this call can appreciate, having gone through some of the previous lectures as well. But what I'm talking about is the health impacts of the choices that we make to avoid these devastating health impacts caused by wider climate change. And what does avoiding climate change mean? Well, the IPCC is the kind of the expert group on how to avoid the impacts of climate change and understanding the physical and climate and societal changes that are needed. They're very, very clear that the globe as a whole needs to reach net zero greenhouse gas emissions by the middle of the century in order to be in the window of between 1.5 and 2 degrees of warming. Now, 1.5 and 2 degrees of warming is still a really extreme temperature rise. It's something that will have very, very significant impacts on people, on populations, on economic systems, on food systems, on everything that we do in the world. But it will mean avoiding the most devastating effects of climate change. So you can see from this chart here in the top left, that a 1.5 degree world means reaching net zero CO2 emissions by around about 2050 in that scenario, and reaching kind of global net zero emissions for all greenhouse gases at some point in the middle of the century. And I think the other thing that this demonstrates is that there are choices of how we go about reaching net zero, and that's what I would like to kind of bring to you today is the idea that there are lots of different options within the pathway towards net zero that mean that there can be various different impacts on society and on human health. So this chart in the middle here shows that the balance of the residual emissions from where we go today in 2019 through to what an actual net zero world looks like, the balance of emissions and how that transition is shared across different sectors can be very, very variable and could lead to very different outcomes for society as a whole. So I thought I'd start with this. What does net zero look like in practice? So this is a pictorial representation of the world as it is today. So we have a number of different economic sectors, most of which are currently very high carbon. We have a power system which generates electricity, and most of that electricity at the minute comes from the combustion of fossil fuels, but with an increasing level of penetration of renewable sources of energy in electricity networks. Some of that electricity is used to light our homes, used for cooking, used for heating, used for cooling in various different contexts. But also within the home, there are additional combustion of fossil fuels as well. So natural gas for cooking, for example, or the combustion of natural gas in colder climates for water heating, space heating. It could be the use of LPG boilers in a home, for example. We move ourselves around, so we have a transport system that today is largely driven by fossil fuels as well. So we have trucks and vans that move things around and do logistics, and we have cars in general and motorcycles that carry people around to the places that they want to go to. And again, most of that is currently emitting fossil fuels. There are some green options within there. There is a growing market for electric vehicles, but that is a significant contributor to climate change today. Industry, some of the energy consumption of heavy industry is from electricity use, but also a very significant proportion of emissions from industry come from the direct combustion of fossil fuels. We have waste, where either you can reuse and recycle the material that we tried to discard, or it will end up in an incinerator or in a landfill, which leads to additional emissions as well. Aviation and shipping, again, heavily dependent on the combustion of fossil fuels. Agriculture, where we have more of a low carbon option through the cultivation of crops, moving through kind of increasing levels of carbon intensity of food production from kind of poultry and pig farming all the way through to the most polluting type of agriculture, which would be beef and dairy farming, due to the methane emissions that are emitted by the livestock. And then finally, there is land use and land use change. So there is a constant flux in the forest stock in the world. Trees are planted and trees are cut down, and in general, for every tree that you cut down, and unless it is replaced with a new tree that is growing, that leads to an increase in carbon emissions as well. So at the minute, lots of red on this chart, and I'm going to talk about how we can start to turn some of that red high carbon activity into low carbon activity instead. So the first thing that is happening today, and it's happening at scale. So the first thing that you would think about when presented with this challenge potentially is, well, let's make electricity low carbon. So already in many countries, in many different contexts around the world, we are seeing a rapid expansion in the rate of low carbon electricity generation. That is, from my point of view, as a climate kind of mitigation person, that's excellent. It means that the electricity we generate is usually more secure and in a domestic environment and less reliant on foreign imports. It is as cheap now as any other form of electricity generation. Solar panels are basically abundant and cheap and clean electricity for large parts of the population. You do need to build in some storage to allow for the variation in the way that electricity is generated. But as soon as you do that, immediately, two of the things that were causing emissions previously, which is electricity consumption in the home and in industry, also become zero carbon activities. So the knock-on effects of doing the power generation transition also have impacts on the emissions associated with homes and industry, and of course the health system that kind of sits in between those two things. So the next thing that you would think about then is, okay, well, now that we have this source of clean electricity, what else can we plug in? And the obvious answers are in the home and in the transport world, and also in industry. So let's start to electrify things in the home instead of a natural gas boiler, for example, in the house, which causes carbon emissions and also causes indoor air pollution. Let's maybe switch to an induction hob, or from a gas boiler for water heating to an electric heater, whether that be immersion or a heat pump. The electric vehicle market is taking off and taking off rapidly. Some countries now have the vast majority of new vehicles sold are electric, and that is an opportunity for countries to capitalize on the increasing penetration of green electricity in the grid. And you can also do that with some of the freight that exists within the transport system. Some very high load, big trucks do not yet have the drivetrains that are needed to be able to electrify, although that is something that with improved battery performance in the future, we would expect to slowly be able to come in. You can also, therefore, now that we have this abundant and cheap energy, you can switch some industrial production as well over to electricity. But all of this transition and switching of stuff away from fossil fuels in the consuming economy means that you need to produce more electricity to match that demand. So we speak a lot about the need to triple renewables generation. That's not just replacing existing capacity with renewables, it's actually building electricity capacity to be able to have these additional transition effects elsewhere in the energy system. Another thing that you can do is the idea of reuse and recycling. So switching from instead of discarding material, you would switch to reusing and recycling more of it. That not only has the effect of minimizing emissions from waste treatment, it also has the additional benefit of reducing the need for new material in the supply chain, because you're taking advantage of that. You've already produced materials and transported it to the place that's needed. So a shift towards increasing recycling and reuse will also result in a reduction in some of the transportation emissions associated with bringing materials to consumers and to health systems. Healthier diets and reduced food waste is another thing that you will hear people talk about a lot in the climate world. So moving away potentially from particularly beef and dairy sources of protein and increasing the number of plant-based sources of nutrition within the diet not only has positive impacts for population health, but also helps to reduce emissions associated with waste from the overproduction of food, from the livestock itself. And also, if you are producing food in a more efficient way, you minimize the need for deforestation in order to produce land that can be used for agricultural purposes. An additional step that, again, is being taken and taken up rapidly in lots of different places is the idea of more sustainable travel choices. In particular, the use of long distance rail to avoid flying can have a really significant knock-on effect from replacing those shorter aviation journeys with a zero or close to zero carbon alternative if it's an electrified train network. And people are starting to think about making those personal choices in how they move around the world. The final two things then really are about dealing with the tricky remaining problems. So we now have this system where some of the power, some of the firm power that's needed to keep the grid operating is still potentially a high carbon activity. There are potentially some high carbon areas in transport, in an industry where electrification doesn't make economic sense. And there are residual emissions in hard to decarbonize sectors like aviation, shipping, and agriculture as well. So one of the things that you can look at is carbon capture. Sadly, there's not a ready-made icon for carbon capture, so I've chosen to use balloons here. But this is the capture of carbon through absorption columns and turning it into a liquid form that can then be safely stored somewhere underground or used in making materials, which is an active way of stopping emissions from going out into the atmosphere. So there is an opportunity in carbon capture. There are some discussions around switches to alternative fuels that don't produce carbon when combusted. So the use of both hydrogen and potentially ammonia as fuels for combustion. Obviously, those two fuels don't have a carbon molecule in them, and therefore they won't produce carbon when combusted. And also potentially the use of biofuels as well. The idea being that if you grow a wood or a plant-based fuel, it sucks in during its growth the carbon that is then released during its combustion. So over its life cycle, it is a carbon neutral source of fuel. All of these things are more contentious, and there exist options within the pathway of how exactly these hard to treat sectors would be addressed. And then the final thing that we need to do as a society in order to reach net zero is recognize that there will always be some source of emissions in the economy. It's up here today and it needs to come down to here. But in order to balance out those residual emissions, we also need to remove CO2 from the atmosphere. The easiest way to do that is through afforestation and tree planting, but also there is some positive sounding research going into the actual direct capture of CO2 through technologies that can effectively hoover in carbon dioxide directly from the air and store it safely in the ground. So all of these things need to happen to varying degrees in order to reach net zero. And it's a big transition, I think, is the other thing that I would like to impress on you is this is not going to be easy. It's going to require very wholesale changes in the way that the economy is structured and the way that it functions, and in particular, the way that we move energy and people and things through our economies. To kind of frame that in context, this is a piece of work that I assisted with for an organization called the UK Committee on Climate Change, and this is the series of actions that they recommend for getting from where we are today and the top line, which represents kind of business as usual, down to a net zero world in 2050. And all of the things I've just talked about exist within that chart of how they think you can get there. So the first thing is reducing demand. So things like healthier diets and sustainable transport and energy efficiency as well. A big chunk of the transition will be driven by electrification. So the generation of zero carbon electricity and the mass electrification of a transport and heat and industrial network. And then the final harder to achieve bits around alternative fuels, more sustainable agriculture and tree planting, and potentially the direct capture of carbon for storage as well. This is going to cost money. The technologies that are needed to do this are not free. But another really interesting result from this piece of work is that actually net zero represents a capital investment program. So you need to spend money today on the technologies and infrastructure that is required to reach net zero. But over the long run, net zero societies in general are very efficient. And the efficiency and the savings that brings you in terms of the operational costs of running an economy mean that over a 25-year transition, you actually end up paying back more than your initial investment in savings in running costs in later years. And certainly by the point that you reach net zero, that investment requirement is no longer there, and you are reaping the benefits of the investment that you've made into efficiency. And then to put it again in a health system context, this is a piece of work that I contributed to in the NHS over in the UK. Again, very similar actions need to be taken within the NHS on its sources of direct emissions. There is decarbonisation of the electricity grid, which is outside of the control of the NHS. It's the power that comes in through the plug. There's not a huge amount that the NHS can do about it, but it depends on the rest of the economy to do that for us so that we can reach our net zero goals. And then again, things like resource efficiency, targeting specific medicines that are very high carbon, electrification, efficiency, and then some room at the bottom for the need for greenhouse gas removals or other innovative solutions to offset the remaining balance of emissions. So the good news is that all of the things that I've talked about there will have positive impacts on public health, and we'll go into the detail of some of those in a second. There are lots of different choices and pathways on how we get to net zero, and as a community of healthcare workers and public health experts, we should feel the right and the need to go and inform how those choices are made. And the final point is that net zero societies are incredibly energy and resource efficient, meaning that they save society and they save health systems who adopt net zero money in the long run. And that's money that can be spent on other things that we want our economy to do. It means we can invest in medicines and MRI machines and other aspects of a healthcare system that help us to do the thing that we exist to provide. But there are some risks. Some of the mitigation actions that we talked about, and some of you may spot some red flags on some of the changes that I've suggested, can potentially result in negative health impacts unless we could put good preventative measures in place. The big thing I think that is underappreciated is that there is a big transition risk for net zero. So the idea of this big wholesale structural change in the way that the globe does things could potentially put people at risk. And in the case of any big transition, it will be the more vulnerable people in society that face the largest effects of that risk. And then it's a contextual thing, but we are living already in a rapidly changing climate, and that makes all of this transition far more difficult because there are unpredictable impacts of climate change that we will have to deal with on the way towards net zero. So the first topic that I'll introduce and hopefully is one that is familiar to many of you is the idea of air quality and respiratory health. The things that we do today that cause greenhouse gas emissions are also closely associated with air pollutants, and I informally categorize that as the combustion of fuel, of farming and deforestation, and then things that move, so things that create particulate matter that is dispersed into the atmosphere. In particular, we'd be concerned with oxides of nitrogen, particulate matter, sulfur dioxide, ammonia, and volatile organic compounds. And again, I'm not a population health expert. I'm not an air quality expert, so I'm not going to go into today the distinct impacts of these things on human health. But these are air pollutants that have very, very damaging impacts on population health in general. And there are clear wins on air quality here. So this is a kind of diagram from a Royal Society report on the effects of net zero on air quality. And you'll see the dotted line in the middle here is where there is a no effect, and anything to the right is stuff that has a positive effect, and the vast majority of stuff exists within that world. So replacing fossil fueled electricity is a huge benefit for reductions in air pollutants, and then shift to increased levels of walking and cycling and public transport can have positive impacts on air quality. Improved nitrogen management in agriculture to reduce nitrous oxide emissions, which is a greenhouse gas, will also reduce emissions of ammonia and oxides of nitrogen. Similarly, increased reuse and recycling and reduced landfill use will also reduce some of the co-pollutants. So there are very, very clear wins with relatively little downside that will happen as a result of the net zero transition for air quality. There are also opportunities. So electrification of vehicles will have a vast improvement on the emissions that are coming out of the tailpipe of cars. However, we do need to recognize that cars also produce emissions from non-exhaust particles, so from tire and brake and road surfaces, that will continue to be a problem even once the petrol and diesel engines are replaced with electric ones. And there are some worries that trends towards the use of heavier vehicles and increased usage of those vehicles could actually increase some of those non-exhaust emissions. So again, very, very clear benefits from electrification of the fleet, but with some potential downsides. Indoor air quality is another important one. The need for energy efficiency in buildings potentially could result in reduced ventilation and therefore build up of levels of air pollutants indoors. It's not an insurmountable problem, but it's a risk that we need to consider. And then there are some things that actually could have damaging, harmful impacts on population health. And this is where, as a health community, we need to step in and potentially influence some of the decisions that are being made here. So there is lots of talk about the combustion of biomass for transition to net zero purposes. If I were a purely carbon analyst, only interested in greenhouse gas emissions, you would probably say, yeah, great, good idea, life cycle zero emissions, easily transportable, easily implementable in the home. But there are very, very negative health impacts associated with the combustion of biomass, particularly in indoors and in urban areas. And in fact, that would almost be, I think, a strong policy recommendation from many people here, is that biomass combustion should be avoided in those areas and actually reduced in those areas. Potentially also risks around some of the novel fuels such as hydrogen, and some volatile emissions associated with the growing of fast-growing crops for biofuels as well. And this is something that health systems can contribute to as well. So this is a diagrammatic description of where the hospital's own effects and impacts on clean air can be driven within a health system context. So switching to electric vehicles for delivery and ambulances, consumption of renewable energy, and some of the choices that can be made around green spaces and provision of sustainable transport can improve the air quality in the immediate locality of a hospital setting as well. Active travel and public transport is another big one. Any switch towards walking or cycling or the use of public transport has a positive environmental impact because it takes someone away from the use of a car. We know that low levels of physical activity result in poorer health outcomes. And we've seen some evidence to show that active commuting, so walking or cycling, is very, very heavily associated with reductions in risk of cardiovascular disease and type 2 diabetes. There are also benefits for health for switching to public transport. It's less well studied, but the idea that you need to walk from your place of work or from your home to a point where you then pick up a bus or a train does have additional benefits. And there are also health impacts there from reduced noise pollution and traffic-related health impacts as well, so congestion and vehicle collisions as well, by taking more vehicles off the road. So again, this in general would be a very, very wide-ranging win for both climate and for health impacts. I've talked briefly already about healthy and sustainable diets. The Eat Lancet Commission came up with a series of recommendations on what a planetary health plate looks like. But again, in general, any switch from the highest carbon and often least healthy types of food towards a more sustainable diet of fruits and vegetables and grains generally supports the double win of both sustainable food production and also improved health outcomes as well. And there is the additional benefit of removing the need to clear forest for increased inefficient farming, which therefore gives you the opportunity for reforestation, for conservation of biodiversity, or for green public spaces, all of which ultimately are good things in general for population health. Water and waste and sanitation, so switching to more effective and efficient systems for treating water and waste will generally reduce people's exposure to hazardous waste, reduce people's exposure to hazardous air pollutants as well, and ideally also improve the quality of water that people have access to. And also, again, this idea of switching to increased rates of recycling and reuse of devices also will help to reduce the harmful impacts of waste treatment within a society, because there is less of a demand and less of a need for waste treatment if we are reusing and recycling more of the things that we purchase. And on the right here, I have a diagram from a colleague of mine, Professor Rizan, who's done some really great work to show that in basically every single context of purchasing something as a healthcare system worker, if you can buy a reusable device instead of a single-use device, it will have better lifetime emissions performance within a health system context. And there's some examples there on the chart on the right. And then the final theme that I guess I would like to talk about briefly is the idea of the transitions. So there are direct health impacts of the technological and societal changes that will happen on the way to net zero, but there is also a transition risk. So In general, you see that the lowest income households this is a study from the UK, but this will apply globally. The lowest income households are likely to spend a much higher share of income on energy. And if energy prices rise, they will use less energy correspondingly. And that means potentially exposure to extreme heat or extreme cold, depending on what that energy is used for in the home. So this means that we need to be really, really careful on energy prices and the impact of the transition on prices as we move towards net zero. And we need to protect people from potentially harmful changes in pricing, particularly at that lower end of household income. And the other side is that there are barriers to improvements, and those barriers exist more so for people who are generally disadvantaged in society. So typically, an electric vehicle might cost slightly more upfront. It's a brand new vehicle, but it will save you money over the lifetime of running that vehicle. And so you are presenting a barrier to someone without the capital ability to pay for a vehicle to benefit from the efficiency savings that an electric vehicle brings you. Similarly, people in rented accommodation probably are less likely to have control over the decisions made on the infrastructure and the energy that's used in their home. And there is a split incentive where a landlord would have to pay for a switch to an electric heater or a heat pump, but wouldn't experience any of the bill savings and therefore is less likely to make that investment. There are also the ideas of digital exclusion and complexity and long payback periods that might affect elderly populations in particular. And then there is a global side of this as well. So I sit here in Singapore. Singapore, I think, takes some credit for being the green island, and it has a lot of sustainability action going on. And it's very, very, I think, very proactive in addressing its own emissions that are produced on the island. But also Singapore is the single highest consumer of emissions embedded in the goods and services that are brought into the economy here. The speed and the scale of this transition introduces a risk of change in the social determinants of health. And that exists in individual countries and globally as well. So the transition risk is something that we need to watch out for as a health community. There is a risk of effectively offshoring, the offshoring net zero. So the chart on the right shows that high income countries generally consume more emissions than they produce, whereas lower income countries typically produce emissions. They produce materials and goods and energy, which is then exported to richer countries in the world. So the idea that you would offshore your kind of dirty production in a high income country, while low income countries would still be facing the negative health impacts of the high carbon production that exists as well. So there is a need for equalizing and spreading the benefits of this transition as well, and a risk to vulnerable populations in the transition. And then finally, the idea of stranded assets. So lots of the things that we're talking about here are positive things for population health, but you need the capital in order to make those changes. So we see two potential examples. Electric vehicles are cheaper to run, they're more comfortable, they're more reliable, they're safer. How do we ensure that people and communities who can't afford those new vehicles now get to experience those benefits? And that is a question as much for a government economics department as it is for a public health department. Another example that we've seen in Pakistan recently is solar PV is now incredibly cheap and an investment that is so worth making that households and businesses who can afford to do it are coming off the grid. Unfortunately, though, that pushes the cost of running the grid onto the very people who can't afford to invest in the solar power in the first place. So there is transition risk associated with all of this, and any risk to population that causes increases in inequality will invariably have impacts on health inequality as well. And then I think just about on time to wrap up. So I wanted to finish with some ideas about what we can do as a network of health professionals and people in the health research field. So I think the first thing it is exactly what's happening on this course, but the idea of leading by example and demonstrating how in decarbonizing our own sector, we can bring cost savings and efficiency improvements and health benefits and improve patient outcomes through the decarbonization of healthcare. We need to recognize, though, that we exist within an energy system and an economic system where the health sector is dependent on other parts of the economy for our own ability to decarbonize. And we need to acknowledge that we are affected deeply by the decisions that are made in other sectors of the economy in trying to reach those goals. We should be an active voice in shaping the transition of other sectors. In general, health professionals are trusted voices of society and therefore have a unique ability to advocate for climate action. And also the incredible purchasing power of health systems actually gives us leverage to change the speed and the nature of other sectors' transition to net zero. Health experts should be involved in climate policy design from the foundations, and health ministries and public health bodies should take a role in shaping the decisions that are made about how exactly we transition to net zero. And then final 2 points are around protecting vulnerable populations. So being aware that transition brings risk, and where those risks are experienced are typically going to be in more vulnerable portions of society, and those present health risks to those portions of populations. And then finally, advocating for a just transition. And that means doing it domestically, ensuring that the benefits are spread widely and the costs are borne fairly. And importantly, it means doing it internationally as well, and ensuring that it's not just the countries who are able to afford to go early on net zero who are able to experience the health benefits and positive impacts of the transition as well. If you would like to learn more about the work of the Centre for Sustainable Medicine at National University of Singapore, I flashed a QR code just up there for now, but I think that is me done, and I think I've finished just on time, so I will stop sharing and pass back to our moderator.
All right, thank you very much, Tom. I think it's a very comprehensive lecture, and I love the visual. The color is really striking and opened my eyes, at least. And I love the way you presented about not just doom and gloom. It's also about hope, right? Because we already impacted by the climate change, but if we do something that could reduce the greenhouse gas emission, we could find that hope of benefiting us in terms of health. And I think this is very important as well as a healthcare professional, because we don't want to get burdened to our healthcare institution, people who came with more non-communicable diseases and infectious diseases because of the climate change. And also you talk about just transition. I think it's very important as well, because we want to do transition that is just, because people who are vulnerable, people who are marginalized people like pregnant mothers, children, elderly, indigenous people, they are the most impacted by this climate change. And also the last one, you talk about the role of healthcare providers or researchers. I think it's very important as well, because as a healthcare professional, I think we see people every day, right? Like, for example, doctors, we see patient every day, and we could take this opportunity to kind of like inject this hope. For example, like say to them that if you do this something good to the environment, you will get a healthy heart, for example. So I think we have the opportunity to inject the hope to our patient, as well as to to advocate to get them aware about this. So just gonna go straight to our first case study, which will be presented by Prof. Sotiris Vardoulakis. Prof. Vardoulakis is a director of the NHMRC Healthy Environments and Life, HEAL, National Research Network, and a professor of environmental public health at the University of Canberra Health Research Institute. With over 25 years of experience, he has held senior positions in the UK and Australia, including Director of Research at the Institute of Occupational Medicine and Head of Environmental Change at Public Health England. He also has advised governments and international organizations, including World Health Organization, UNEP, and the European Parliament on climate change, health impact, air pollution, and sustainable development. Over to you, Prof.
Thank you very much, Alaa, for the generous introduction and the invitation to present a case study today. So I will share my slides. I hope you can see my my slide. Okay, I hope that's all right. So it was great to have Tom's presentation setting the scene for this case study. So I'm focused on one of the sectors that Tom mentioned in his presentation, which is the household energy sector. And I will present some findings and outputs from a research project we completed earlier this year on clean energy for healthy environments and lives. As Alaa mentioned, I'm the director of the HIL Network and the HIL Global Research Center at the University of Canberra. I will give a little bit of an overview of the work we're doing as well in the next 15 minutes or so. I would like to start by acknowledging the traditional custodians of the lands where I work and live. So as we do always in Australia, we acknowledge the Aboriginal and Torres Strait Islander peoples who are the first custodians of the land, seas and waterways of Australia. And I would like to pay my respects to Aboriginal and Torres Strait Islander people online, any other Indigenous researchers, students and collaborators from across our networks. The HIL Global Research Center focuses on 3 areas of work, 3 pillars, I would say. The first one is on assessing the risks of climate change on health and the environment. The other pillar is on evaluating interventions, and this can be mitigation interventions or adaptation interventions. So by mitigation, we mean interventions that aim to reduce greenhouse gas emissions from the health sector, from the society more broadly, and also adaptation, which means to adapt to climate change and by other environmental stressors in the health sector, but also in the home environment and more broadly. And a lot of our work is also focusing on translation, so translating the scientific evidence into policy and practice, and work very closely with the government organizations, local authorities, and the health sector more broadly to implement those interventions. So, as I mentioned, I will focus on a project we completed recently on clean energy in India and also in Australia. So the focus is on rural India and remote Australia. We have a range of collaborators in this project, including the Indian Institute of Technology in Madras, a number of universities from Australia, and I should mention also that the study was funded by the Australian government, the Department of Foreign Affairs and Trade. To give some context, around 1/3 of the global population, 2.1 billion people, are still using cook stoves or open fires for cooking, and this involves burning of solid fuels. This could be firewood, other forms of biomass, could be coal or kerosene as well. So these inefficient stoves on open fires generate a lot of smoke and a lot of pollution, which pollutes the indoor environment. And this is what we call household air pollution, the pollution from these sources in the indoor environment. And what you see here on this global map is the deaths attributable to household air pollution around the world. These are rates per 100,000 of population and age standardized. So we can see here the worst affected countries per capita. So Sub-Saharan Africa is very heavily affected by household air pollution, but also South Asia, India in particular, Central Asia, China, and Southeast Asia and the Western Pacific. So it's a very widespread problem for public health. As I mentioned, 2.1 billion people using this kind of cooking devices and producing a lot of household air pollution. And the impact on mortality globally, as I will show you in the next slide, is 3.2 million attributable deaths. So these are deaths attributable to household air pollution alone. We know that other air pollution plus household air pollution have an attributable burden on mortality, which is around 7 million deaths every year. So it's one of the key of the leading environmental risk factors globally. Outdoor air pollution has been improving, and household air pollution has been reducing in certain parts of the world, but still a sticky problem in many low-income countries and in middle-income countries as well, especially in rural areas. As you can see here, some of the health endpoints. So the smoke from these inefficient stoves affects mainly the female members of the family, who spend more time cooking in traditional households. Also, young children who spend a lot of time indoors with in this low-income settings. A lot of the deaths are associated with strokes, 23%, 32% ischemic heart disease, 90% chronic obstructive pulmonary disease, 6% lung cancer, and 21% lower respiratory infections such as pneumonia or bronchitis. A lot of these impacts are in children below the age of 5. A lot of these attributable deaths, and also, as I mentioned, in women and young girls. Beyond the impacts of smoke, household air pollution has many other societal impacts. So, especially for the female members of the households who traditionally spend more time cooking and more time collecting firewood. So it has an opportunity cost. So it has an impact on educational, professional attainment and opportunities to do other things in their lives, and of course it affects the whole of the community, entire communities. It's a spiral of poverty and loss of income and loss of health and well-being for those communities who are impacted by household air pollution. Household air pollution also has an impact on the environment. It emits greenhouse gases, multiple gases and particles. It has an impact on deforestation. So a lot of this wood, which is used in cook stoves, is not sustainably harvested. So it increased deforestation, it increased pressure on biodiversity, and soil erosion. So it has multiple environmental impacts as well as health and societal impacts. Looking more specifically at the situation in India, so India is in the process of decarbonization, electrification to some extent, but there's a very strong penetration of LPG in many households. However, rural communities still rely very heavily on wood or firewood, and currently around almost half of rural households in India are using biomass fuel for cooking, and this could be firewood, could be animal dung, could be agricultural waste. And as I mentioned, the impacts are mainly on women and young children. Now, switching to the Australian context, the Australian context is obviously different, but there are some similarities, and this is what we're interested in as part of this study. So we looked at remote Aboriginal communities in the Northern Territory, which you can see here on the map. So these are remote areas in Australia. They are not connected to the main grid. We're talking about relatively small Aboriginal communities living quite far from city centers, so they are not on the grid. They rely very heavily on diesel generators for their electricity needs, and there is some penetration of solar microgrids, which is what we try to encourage and promote as part of this project. So just to highlight the impacts of diesel generators in those communities. I'd highlighted here that around 25 million liters of diesel are used per year, and that comes at a high cost, environmental cost, air pollution, impacts on health, but also impacts on the economy. Diesel is expensive. Transportation of diesel to those communities is also expensive. So many impacts are related to diesel generators, and also many potential benefits and co-benefits related to decarbonization and higher penetration of solar microgrids in particular. Now, moving to the southern half of Australia. I would like to highlight another problem related to household energy, which is wood heaters. So in many cities in Australia, wood heaters is the main source of air pollution, believe it or not. Wood heaters are used in less than 10% of households in Australia, but is the main source of air pollution in many cities. Cities like Sydney, Melbourne, Adelaide, Canberra, where I live and work, they're very heavily affected by wood heater smoke, wood heater pollution in the cooler months of the year. And you can see here some pictures from Canberra, the capital of Australia, which is at some distance from the coast. So there are atmospheric inversions which keep air pollution closer to the ground, and you have this stagnation of smoke in urban and suburban areas, which is causing a lot of harm to communities. I will highlight the impacts of wood heater smoke on mortality. So you can see here a study recently published by colleagues from the University of Tasmania. They calculated the impact of wood heater smoke in different states and territories, and the national annual burden or mortality from wood heater smoke was estimated to be over 700 deaths a year. So it's substantial impact on mortality. We have done an additional study in Canberra, which indicates that the impacts might be even higher than that. Now, going back to the bilateral project, going back to the international project with India and Australia, looking at remote and rural communities. As I mentioned, the objective was to promote the adoption of domestic solar systems and microgrids. So we engaged communities. So we had a number of discussions, focus groups, interviews, engagement with schools in the communities. We look at the different perceptions and awareness levels in relation to smoke from biomass used for cooking in those communities or heating. And also we try to identify barriers and enablers for the increased adoption of solar systems. So here you can see some of a summary of the barriers identified in the Northern Territory in Australia, looking discussing with the remote Aboriginal communities. So these barriers include economic barriers, as Tom mentioned earlier in his presentation. There is an upfront cost, capital cost when families invest into solar, obviously. Although there are some subsidies, there are also subsidies for diesel. So there is an economic argument there that we need to make and explain that over the long run, solar systems can be beneficial for the economy and the local economy and the households' economy. There are some regulatory barriers, administrative and bureaucratic complexities in connected, establishing, putting the solar system on the roof and connected to a microgrid. There are some technical barriers, including the technical know-how, the availability of spare parts for maintenance. So there are some technical barriers and also some social barriers in terms of public awareness, information, and some perceptions about different types of energy which have been used for a long time. So when we look at the benefits and the opportunities to promote solar, we want to highlight the environmental benefits. Not everybody's aware of those benefits in terms of climate change mitigation, in terms of improvements to local air quality and indoor air quality. So we want to highlight those benefits. There are additional benefits in terms of thermal comfort and related impacts from heat and cold. So we can, with electrification, we can improve thermal comfort as well as improving indoor air quality. and also improve food storage, medication storage in places which can overheat in a good part of the year. And of course, for Aboriginal communities, there is the additional benefit of staying in country, which is very important, making life better, make living conditions better, and improving housing, which is also something that can help the promotion implementation of solar systems in communities. Of course, there are other considerations, which is the full life cycle of current solar installations, the cost, and the implementation and technical aspects, which I mentioned earlier. So just to give you a very quick overview of communication tools that we use during this promotional campaign for solar energy. You can see here some social media tiles promoting solar in India and Australia, highlighting also the Sustainable Development Goals, which are relevant to this intervention. And it's not only affordable energy and clean energy, it's also good health, it's climate mitigation. There are multiple SDGs which are relevant to clean energy, clean household energy. We made the connection with the improved housing conditions. So as I tried to highlight, good housing conditions, improved housing infrastructure, and clean energy go hand in hand. And we aim to promote both improved housing conditions and clean household energy. Just to highlight here, a beautiful Aboriginal painting, which was commissioned as part of this project. Again, inspirational, making the point of clean energy and speaking to Aboriginal communities and who use this kind of communication through art, and of course this resonates also with non-Indigenous audiences. Some outputs from our engagement with schools. So you see here some school posters from a student competition, again engaging with young people and their families, promoting and raising awareness about clean energy. And also put here a video that we produce some short videos. We can show you that if we have time at the end, a couple of minutes, following an Indian family and their journey to transitioning to clean energy. So please visit our website, the Hill Network website. There are many projects and case studies which will be relevant to this course on climate change and health. And get in touch with the Hill Network, and of course very happy to discuss and take any questions. Thank you very much. Hope that wasn't too long. Alaa, over to you.
Okay, stupid. Thank you. All right. Thank you very much, Prof. Sotiris, for the very interesting case studies. I'm going to go straight to our second case study, which will be presented by Dr. Alice McGushin. Dr. Alice McGushin is Assistant Director at the Australian Government Department of Health and Aged Care's National Health, Sustainability and Climate Unit. She is an Australasian Faculty of Public Health Medicine Registrar and Honorary Research Fellow at University College London. With over a decade of experience in climate change and health, Dr. McGushin leads Australia's health system decarbonisation efforts and international climate health collaboration. A medical doctor by training, she has collaborated with organizations including the Partnership for Maternal, Newborn and Child Health, the World Organization of Family Doctors, and the Canadian Association of Physicians for the Environment. Over to you, Dr. McGushin.
Thank you very much, Alaa, and thank you for the opportunity to present at today's session. I will just share my screen. Bear with me. I'm connecting on the browser, so it's a little bit more clunky. Alaa, can I just confirm that you're seeing the right screen?
Yes.
Perfect.
Perfect.
Okay, well, thank you again for the opportunity to speak to you today. I want to start by acknowledging the traditional custodians of the land on which I am presenting to you, the Ngunnawal and Ngambri people, and I pay my respects to elders past and present and future. I'd also like to extend that respect to all First Nations people joining this webinar today. I'll also start by saying that now that a federal government election has been called for the 3rd of May this year, our government is currently in caretaker mode. And so I will be presenting in accordance to caretaker conventions, which means that I can present on work that has already exists and has been completed, but I can't speak to any future work. So I will start by outlining Australia's first national health and climate strategy, and then I'll go into a little bit more detail into some of the objectives of the strategy: health system decarbonisation, international collaboration, and then health in all policies. Australia's first national health and climate strategy was launched by Assistant Minister for Health and Aged Care, the Honourable Jed Carney, at COP28 in Dubai in December 2023. And the strategy sets out a whole of government plan for addressing the health and wellbeing impacts of climate change, whilst also addressing the contribution of the health system to climate change. The strategy's vision is healthy, climate resilient communities and a sustainable, resilient, high quality net zero health system. And as I alluded to, the strategy has 4 objectives. The first is health system resilience, which is to build a climate resilient health system and enhance its capacity to protect health and well-being from the impacts of climate change. The second, and one of the ones that I will focus on today, is health system decarbonisation, to build a sustainable, high quality net zero health system. Third is international collaboration, to collaborate internationally to build sustainable, climate resilient health systems and communities. And finally, health in all policies, to support healthy, climate resilient and sustainable communities through whole of government action, which recognises the relationship between health and climate outcomes. This strategy is also underpinned by 4 enabling actions. And so these are workforce leadership and training. And so supporting and engaging the health workforce to raise public awareness of the health impacts of climate change, strengthen the resilience of health services in providing care to affected populations, and lead innovation in reducing health system emissions. So this will help support achieve the objectives of the strategy. The second is research and innovation, which is investing in and supporting coordinated climate and health research to improve the evidence base for responses to climate change. Third is communication and engagement, which focuses on improving how agencies communicate and engage with the public to ensure action to address the health impacts of climate change and decarbonise the health system, and make sure that that's understood and endorsed. Fourthly is collaboration and governance, ensuring that appropriate governance structures to facilitate regular collaboration with all stakeholders, measure and track progress in the delivery of the strategy, and drive action and hold policymakers and stakeholders accountable. So I'll move on to speak about health system decarbonisation and also how this relates to health co-benefits. So the strategy, in the National Health and Strategy, we're working to decarbonise the health system across all of its emissions. And so they're categorised in scope 1, 2 and 3 emissions. And so what they are is the scope 1 emissions are the emissions that we directly contribute. So these include anaesthetic gases like nitrous oxide and desflurane, as well as on-site fuel use. So, for example, use of natural gas for heating or for sterilisation or for cooking, as well as the fuels that we use for our vehicles in the health system, such as ambulances and other vehicles. Secondly, are the emissions, our indirect emissions related to the electricity that we consume. And thirdly, our scope 3 emissions, which are our indirect emissions. And these can be both upstream emissions from the manufacturing and distribution of products that we consume in the health system, as well as downstream emissions, for example, through the disposal of products that we consume in the health system. And so our approach to achieving a net zero health system is informed by 3 principles of sustainable healthcare. The first is about prevention. So keeping a healthy population, keeping people well and independent, will mean that they are less likely to need healthcare in the first place, which means that if they're not using the healthcare, then we're producing fewer emissions from the health system. Secondly, we look at minimising low value and harmful care. And so what that means is looking at reducing and eliminating care that's unnecessary. So unnecessary investigations and unnecessary treatments, which don't actually result in any benefits to patients or could actually result in harm. And thirdly, we look at the care that remains, the high value care, and we look at identifying hotspots and sources of emissions in that care. So we decarbonise the high value care. So with all 3 of these approaches, the focus is about delivering high value, high quality health care. And so it's improving the health outcomes of patients and the population. Important in addressing our health system emissions is understanding where our emissions are coming from. So earlier this year, we published our first baseline estimate of Australia's health system emissions. These emissions are divided into 3 different areas. So acknowledging that we consider Australia's health system as encompassing both healthcare and aged care. So these 3 areas are healthcare services, residential care and social assistance services, as well as our within Australia, human pharmaceutical and medicinal product manufacturing. So considering the scopes that I mentioned just before, the three scopes of greenhouse gas emissions, Scope 1 emissions, so those on-site emissions from anaesthetic gases, on-site fuel use, as well as fuels for vehicles, contribute 7% of Australia's total emissions. The Scope 2 emissions contribute 20% of total emissions, which leaves 68% of emissions coming from Scope 3 sources. And the majority of those are from the purchased goods and services, which contribute 43% of emissions. In total, these all add up to 23.5 kilotons of carbon dioxide for the financial year 2022-23, which is 5.4 of Australia's total emissions. So what are some early actions that we've taken to reduce emissions from Australia's health system, and how do these result in improved care? So firstly, we've worked with all of Australia's medical colleges to deliver a joint statement on climate and health. And within this statement, the colleges commit to developing low emission models of care, including actions to improve care, minimise wasteful health care, and involve patients in decisions about appropriate care. and also to mobilise and support the health workforce to lead the health system response to climate change. Following the publication of this joint statement, we've established a multi-college working group, which consists of representatives from the medical colleges, as well as nursing, midwifery, and allied health colleges. And we're developing a framework for action to deliver this, to implement this joint statement. Next, as I mentioned, some of our Scope 1 emissions result from anaesthetic gases, in particular nitrous oxide and desflurane. And so we have published a guide on how to detect and reduce nitrous oxide leaks in healthcare facilities. It's important to know that nitrous oxide is an important anaesthetic gas, particularly in paediatric emergencies and in labour and delivery. But most emissions created by clinical nitrous oxide use come from actually the piped manifold system, so leaks within the pipe systems in hospitals. So this guide helps detect those leaks and address those. And then we can, after those have been addressed, we can consider how we change our clinical care. Next, desflurane is a powerful greenhouse gas, which has a high global warming impact, around 13 times that of a clinical equivalent, which is sevoflurane. So we've worked closely with the Council of Australian Therapeutic Advisory Groups, CATAG, as well as the Australia and New Zealand Council of Anaesthetists, College of Anaesthetists, and the Australian Society of Anaesthetists to develop a position statement on the formulary listing of desflurane. Finally, we've also been working with the Australian Commission on Safety and Quality in Healthcare to pilot a sustainability and climate resilience standards for health services. And so this pilot has now completed, and we're assessing how that went, and we're updating this module with a view of informing the next update to the national healthcare standards. So next, I just talk briefly on international collaboration. So we're working closely with the Alliance for Transformative Action on Climate and Health. We're a member and we participate in the Alliance. And we are also collaborating internationally with other countries and other stakeholders to decarbonise the international health system supply chain and to develop an internationally recognised standard for conducting life cycle assessments for pharmaceutical products, so we understand where emissions are coming from for pharmaceuticals. Very briefly, I'll just touch on our work in health in all policies. So across the strategy, we adopt a health in all policies approach, promoting the health co-benefits of emissions reductions across society, across all sectors, and also adaptation action that protects health beyond the health system. So one of these areas which results in health co-benefits that Tom has already touched on is active travel. And so the Department of Infrastructure, Transport, Regional Development, Communications and the Arts has administered a $100 million active transport fund, which encourages an increase in active transport through the upgrading of existing and construction of new bicycle and walking pathways across Australia. And so this project is currently underway with successful projects announced across the country in late February. So as Tom has mentioned, improving transport options with an emphasis on public and active transport will boost average fitness levels while reducing air and noise pollution and overall rates of motor vehicle accidents. And so that has considerable population health benefits and reduces rates of chronic disease. So just my final note, I just wanted to take a slightly different angle given the audience that I'm speaking to today. We have just launched a Pacific Climate and Health Resilience Package, which is funded by the Department of Foreign Affairs and Trade. We'll be working very closely with the Pacific community, the World Health Organization, national governments and other partners across the Pacific region to seek to bolster existing work within the region to support climate and health resilience. This will include work on engagement in health national adaptation plans, vulnerability, capacity and adaptation assessments, sharing knowledge between countries within the Pacific, as well as engaging in the UN climate change processes at the COP conference in 2026. So that's all from me. You can get in contact with me and our unit at the email address on the slide, and I will close it there and hand it back to Alaa for questions.
Thank you very much, Dr. Alice, for the very clear presentation. Now I'm going to jump into the Q&A session. I'm going to go like a round table. So first question is to Tom from Anonymous, asking about controversial carbon capture. It sounds like, what about planting more trees? Isn't this the best option? Sadly, UK has only 13% wood cover compared to 38% average in the Europe. Farmers feed the world, and conventional agriculture makes no sense to them unless you give them an alternative. Can you please give some insight on this one?
I'm on mute in front of 800 people. I apologize. I think it's a really good question. Carbon capture is, I think, certainly a necessary part of the transition in lots of economies. There simply isn't the available land in many cases, in many different countries' contexts, to purely just go ahead with tree planting. So it depends on how much that global effort on decarbonisation needs to be shared, and how much of that capture would happen at a point source in industry versus potentially direct air capture. Reforestation is absolutely an important part of the climate transition, and it is a necessary thing that the globe needs to do, is to plant more trees and to restore peatlands and mangroves and those kinds of natural sources of carbon sinks. Completely right, though, that in order to free up that land for sequestration, the policy needs to be right for agriculture as well. So making sure that there is a fair incentive for people who cultivate and own the land to do it in a way that is sustainable. You can often co-locate tree planting through things like agroforestry, and you can do things like nitrogen management in a way that reduces pollution as well. So yeah, there is a balance between fairness for rural communities, population health, food security, and carbon. And the role of the climate policy expert is to try and navigate between all of those different things. And that's why people from lots of different perspectives need to be involved in the conversation.
Thank you very much for the response. Now to Prof. Vardoulakis. Small island developing states face a unique set of challenges in their transition to renewable energy. Are there best practices to this where small islands are able to overcome?
Thank you. Very, very, very important question. I think the clean household energy transition should be an intervention, should be something that small island countries should be considering and investing in. The solar microgrids that I mentioned, this can be potentially a solution for remote islands, as it is a solution for remote communities in Australia and India. So I think there is a lot of potential there in terms of transitioning from diesel, transitioning from biomass burning, transitioning from high polluting energy generation methods to renewable. It could be solar, could be wind, could be other renewable energy sources, depending on the situation and the realities on the ground. But I do think that the transition to clean household energy can benefit very substantially small island countries in the Pacific and more broadly.
Thank you very much, Prof, for the response. Question to Dr. Ellis. Inadequate maintenance services can be a challenge to the widespread adoption of solar energy in rural communities in low-income countries. Is there any solutions can be made properly targeting for vulnerable population?
So if I understood the question correct, this is about the technical challenges.
Yeah, but this is for Dr. Ellis. Sorry, Prof. Or
sorry.
if you can answer that question, it applies to you as well.
I think it was about. So could you repeat the question? I think it might be beyond my area. But yeah, go ahead.
Yeah, if you could.
Can you repeat the question?
Oh, you want to repeat? Okay. You said that inadequate maintenance services can be a challenge to the widespread adoption of solar energy in rural communities in low-income countries. Is there any solution can be made properly targeting for vulnerable population?
Yes, solar in vulnerable countries is beyond my area of work, so I'll pass it over to Sotiris.
Thank you. Just to fully acknowledge that there are challenges in terms of the adoption of these technologies in rural and remote communities. I think there is a lot of potential, as we saw with the case studies in South India and remote Australia. There is increased penetration. There are microgrids are becoming better, more affordable. Solar panels have become more affordable. Battery technology as well. So I think it's a viable intervention, certainly for lighting and ventilation, fan systems and ventilation systems and lighting in remote communities. For cooking, the power required for cook stoves, electric cook stoves, is more significant. So that requires bigger batteries and more of an upfront investment. So that there are some challenges there with financing and also with the technical expertise and maintenance. But we see that many villages are adopting microgrids in India. I think there's a lot of potential in the remote communities in Australia. So I think the more communities are using these electric microgrids and solar systems, this becomes like a tsunami effect. You have more know-how in the communities. They have local investment, local ownership of projects, wider availability of the systems and more technical expertise. So we have seen a very high penetration of solar systems in urban areas in Australia. Now currently around 30% of households in Australia have solar panels. So I think this is a key area where we can see a tipping point for global decarbonization, the household energy, the household energy sector. So I think there are some challenges, but clearly a lot of potential there, and there are clearly also some enablers, including the co-benefits narrative and the promotion of these health, environmental, and societal co-benefits of clean energy.
Thank you very much, Prof. Now go back to Dr. Ellis. A question, please, can you give examples of low value of harmful treatments?
Yeah, absolutely. So what we mean by this is any investigation that doesn't actually change a patient's care or a treatment that doesn't actually result in benefits to the patient. So an example of this could be you're requesting routine bloods, so-called routine bloods for a patient, perhaps in family practice, in general practice. Like an example is vitamin D. So where a lot of patients, it might not be recommended for vitamin D to be routinely tested. Another example, I've previously worked in pediatrics. When a child or a baby comes in with a wheeze, with shortness of breath and low oxygen saturation, at least in Australia, it would not be routine to order a chest X-ray on that baby immediately. Some treatments, for example, or other investigations are knee arthroscopies. There aren't many patients who actually benefit from a knee arthroscopy, and so a lot of the procedures that are undertaken are what we would consider low value care. So for all of this, it's about leadership from the medical colleges in setting guidelines on what is recommended when a patient presents with certain symptoms, what tests are to be taken, and what are the appropriate treatments. I hope that answered the question.
Yes, thank you very much, Dr. Alice, for the clarification. There's a bunch of questions, but I think we already reached the end of our session, and I believe that we will try to address your question, or you can directly email presenter about your inquiries. So I would like to express my sincere gratitude to all our speakers for sharing your time and expertise. Thank you for all participants for joining us today. But I would like to conclude some last slide here before we end. For those who not already in the group, WhatsApp group, please, you can just scan this WhatsApp group or WeChat for participants from China regarding the information course, the exam, and everything related. And lastly, please scan with your phone camera for a survey, and give us many constructive comments so we can make it better in the future. Thank you very much, and bye-bye.